I'm Anita Hazari. I'm a consultant plastic surgeon. I've been a consultant plastic surgeon since 2006. A tummy tuck, also known as an abdominoplasty, is a very useful operation for basically two categories of women. And not just women, sometimes men too. Those who have lost a lot of weight, where the skin on the tummy hangs down, creates lots of problems, including sweating in the crease. And that can be very uncomfortable during the summer months, but also when someone wants to exercise. So it's useful to take all that skin away. The second category of patients that I see are women who have finished their families. Now, during pregnancy, what happens is the six-pack muscle stretches and separates out to accommodate the growing baby. And when someone's had one or two or multiple pregnancies, that muscle, instead of sort of snapping back again, closed, stays open, also known as divarication or known as diastasis. Some people call it a ventral herniation, but it's not really a hernia. It's more about separation of the muscle, giving rise to a weakness in the tummy wall, as a result of which afterwards some of my ladies will say, "Oh, I always get comments, I still look very pregnant." So tummy tuck is useful for these patients to take away the excess skin, give a neat contour to the tummy, but also for those ladies who have got divarication or separation of the muscle to actually repair that back again. Smoking and weight are very relevant. Let's just deal with smoking first. Now, the problem with smoking is that it can actually cause what's called as vasoconstriction, which makes the size of the blood vessels smaller, as a result of which the blood supply to the edges of the tummy tuck scar or wound is reduced. And because of that, there is an increased risk of the edges of the skin dying, or what we call in medical terms, undergoing skin necrosis. So it's a really good idea to stop smoking at least 3 months before the operation. And it's not just about smoking, it's also about vaping. Lots of people take up vaping as a way to actually reduce smoking or give up smoking. And what's important in vaping is that the ampule contains pure nicotine, and the concentration of that nicotine is important. It needs to go down to 0 or none at all, really, because if you're still taking in nicotine through a vaping device, then that also causes vasoconstriction, meaning that the size of the blood vessels gets smaller, as a result of which the skin necrosis rate increases. I say to all my ladies who are smoking that if you stop smoking, I can actually pull the skin a little bit tighter. I can't pull it very tight when someone's a smoker, because I always worry, is there enough blood supply going to the edges of the skin, which can give rise to problems after the surgery. The second issue is about weight. Now, several years ago, we did a study at East Grinstead, and we found that our ladies whose BMI was over 40 had almost 100% wound breakdown rate in the abdominal scar. So when I say abdominal scar, I mean the tummy tuck scar, which is central, just sitting above the mons pubis over the hairy bit. And those women whose BMI was between 35 and 40, that breakdown rate was in the region of 50 to 80%, so still quite unacceptable. So many of us feel that to get a good result with the least number of post-operative complications, if you are able to get your weight closer to a BMI of 30, and if it's below 30, even much better, because your complication rate will reduce after surgery. Before I perform the operation, when I see you in clinic, I do two things. I get you to lie down flat on the examining couch, and then keeping your knees straight, lift the legs up in the air, and I'm testing your six-pack muscle. So I'll be feeling it to see if there is a gap. If there is a gap or separation of that six-pack muscle, I will need to repair that when I do the operation. So that's my first bit of the assessment. The second is I get you to bend your knees, and once I've done that, do what I call my pinch and pull. So I grab hold of the lower bit of skin and fat, and I pull it really hard. And what I'm assessing when I'm doing that, to see if there's enough looseness in the upper part to allow me to take all the skin below the level of the belly button and take it away as part of the tummy tuck. When I actually do the operation, you're lying flat on the operating table with a little bit of a bend, and I give you a cut from hip to hip, and then I lift the skin all the way up to the ribs. On the way, I encounter the belly button. Now, your belly button is your old umbilical cord, so I make a cut round it and drop it in so it sits on top of the muscle. So it doesn't go all the way in, it just sits on top of the muscle. And then I lift the skin all the way up to the ribs. And like I mentioned earlier, if your muscle has separated, I repair that. Then I pull the skin all the way down and take away all the skin below the level of the belly button away, and then stitch everything up. Now, one of the things you will say when I've stitched it all up is that you may come back to clinic and say, oh, Miss Hazari, I feel like a waterbed. And what I then have to do is stick a needle in and drain fluid, which may potentially collect between the layers of the skin and the underlying muscle, because this is what we call a potential dead space where fluid can collect. That fluid is called seroma. So one of the special things I do is I do something called quilting. The quilting stitch has got tiny little barbs on it, and instead of putting lots of little knots, it helps to sort of hold on to the tissues, a bit like carpet tacks. And I start right at the top of the tummy, just under the ribs, and then go all the way down, suturing or stitching the skin on the undersurface back to the muscle to reduce that space for fluid to collect. When you've had a tummy tuck, it is not a minor operation, it is a major operation. It takes me about 3 hours to do the operation. You will be in hospital overnight, sometimes 2 days, and it takes about 2 to 3 weeks to recover from the operation. If I've repaired the muscle, it may take longer because you will feel as if you're wearing a Victorian boned corset on the inside, so it feels really tight. And after the operation, I want you walking a little bit bent over, so as not to put too much tension on the tummy wound. As a result of that, you may actually get a bit of back pain, which may worsen, but that sort of eases off with time. In terms of complications, it's same as a lot of operations. First of all, you have to be prepared for this massive scar, which looks like a big smiley face along from hip to hip, and most often it is hidden in the knicker line. These scars, like all scars, take 18 months to fade. In some patients, these scars may not be of very good quality, depending on a patient's ability to scar. The specific problem to a tummy tuck is seroma formation, which is fluid collection. And because of that, I do quilting, where I suture the undersurface of the skin back onto the muscle with this special stitch, which has got tiny little barbs on it. After the operation, all of the tummy skin is numb, but as time goes by, the skin sensation starts to come back, but it can take up to 2 years for the sensation to come back. If someone is a smoker or an ex-smoker, then the complication rate increases, such as bleeding, infection, wound separation, and that's the reason why I ask smokers to stop at least 3 months prior to the operation. After the operation, during your recovery period, you'll have to wear a body shaper or pressure garment, which basically looks like magic knickers, which come all the way up to the ribs. And you have to wear these for about 6 to 8 weeks to reduce the potential for fluid to collect. If you're interested in having a tummy tuck to get rid of excess skin in the lower part of the tummy after weight loss, after pregnancies, by all means ring up One Ashford and make an appointment to see me. I'm happy to see you and give you my very honest opinion as to whether you would benefit from this type of surgery.